So, anti-anxiety drugs. If you know benzodiazepine and barbiturates well, now you could easily proceed because going from anti-anxiety, we in next video we will talk about anti-epileptic drugs, anti-Parkinson drug, and hypnotic sedatives, and so on. So, what is anxiety? Anxiety is dysfunction of limbic system characterized by low level of 5-hydroxytryptophan and gamma amino butyric acid, GABA, 5-HT and GABA. They are low and increase sympathetic system activation with fear. So, normally, in normal words, if someone asks you what is anxiety, it is dysfunction of limbic system characterized by low level of 5-HT and GABA, and due to that, increased sympathetic activation and patient is feeling fear. What kind of fear? Fear which is something not yet happened, but he is fearing about the future. So, in this picture, you could see that there are three neurons. What is happening is, in first neuron, they produce sertraline or serotonin. Sertraline is a drug, and serotonin act on the second neuron, and it will increase the GABA production in this second nerve terminal. From the second nerve terminal, it will decrease the sympathetic nerve system activity. That is what is happening. So, we need serotonin and we need GABA. Serotonin bind with this GABAergic neurons and it will produce GABA. And GABA is a we know inhibitor neurotransmitter, and it will decrease the action potentials produced by sympathetic nervous system. That is what is happening. So, in anxiety, what is happening is, due to decreased serotonin, the GABA release in the second nerve synapse will be reduced. Due to that, sympathetic nerve system activity will be high. Sympathetic nerve system will be high. So, in path physio, in this picture, you could see that this is the limbic system. There is a dysfunction of limbic system, and in anxiety, you could sensate unpleasant sensation of fear, and due to dysfunction, GABA is reducing, serotonin also reduce. Due to that, sympathetic nervous system will be activated. Due to that, in the heart rate will be increased, and blood pressure will be increased, and there will be tremors, and there will be diaparesis as well, and respiratory rate will be increased. All the sympathetic nervous system effects. So that is what is happening in anxiety. So it is very important, if you understand the definition what is anxiety. Anxiety is dysfunction of limbic system which is characterized by low level of serotonin and low level of GABA. If there is low level of serotonin, you cannot excite GABAergic neurons. So due to that, GABA will be reduced. So sympathetic nerve system depression can't be done now. So sympathetic nerve system activity will be high, heart rate will be high, respiratory rate will be high, diaparesis, sweating, tremors will be there in anxiety patient. So drugs, the pharmacological approach now easy. You know what is happening. Why serotonin decreased, GABA decreased. So what could we do? Increase GABA or increase serotonin. So that is what I have written here. Pharmacological approach is to increase both serotonin and GABA, thus increase inhibition of sympathetic nervous system. To increase activity of GABA, we give benzodiazepine. In previous video, in the benzodiazepine video, we talked special 3 indications and mnemonic alprazolam. What is the mechanism of action? You could go watch that video in the benzodiazepine, which is what is happening is GABA A alpha 2 will be bind with this benzodiazepine drug, and it will enhance and mimic the function of GABA. As a consequences, it will increase the chlorine output for sympathetic nervous system. As a consequences, it will decrease the sympathetic nervous system activity. And you could use 5-HT receptor agonist antagonist, mainly buspirone. Nowadays, buspirone is mostly used for anxiety. Buspirone, isapirone, and gepirone. To decrease effect of sympathetic nervous system, we could use this propranolol, beta blockers, beta blocker. This is special beta blocker propranolol, and also uh, antidepressants like uh, SNRIs. Example is venflaxine. Venflaxine. In antidepressant, we talk more about these drugs. Don't worry. But in here, in the anxiety, these are enough. And buspirone. What is buspirone? It's a 5-HT partial agonist. There are some benefits: no anticonvulsant effect, no muscle relaxant effect, no sedation, no tolerance, no dependence, which benzodiazepine has. That's why we prefer base buspirone in anxiety patients. Pharmacokinetics, they are metabolized by liver. Could especially used in mild to moderate anxiety. Common side effects are paresthesia and tachycardia. Paresthesia and tachycardia are most common side effects. So buspirone, where it is affecting? It is affecting first nerve synapse. Here 5-HT, it is a excitatory one for the GABA meningic neurons, and it will increase GABA release, and as a consequences it will decrease the action potentials produced by sympathetic nervous system.